years go by, kids are starting sports earlier and training harder to become the best in their chosen sport and eventually become elite athletes. But is this really what they want? With pressure from parents and coaches being placed on these potential superstars, it is having significant effects on the child's physical and mental health. Overtraining is when an athlete is required to do too much, which can result in physical injuries. Signs of overtraining become evident to the coach. Times are slowly decreasing, there is lack of motivation from the child, becoming tired and lethargic, and decreased ability to achieve training goals. The repetition and frequency of training in children can lead to serious injuries and affect the child's health. Factors that contribute to overuse injuries include intrinsic growth, prior injury, inadequate conditioning, menstrual dysfunction, psychological factors. Extrinsic rapid training, inappropriate equipment, incorrect sport technique, uneven or hard surfaces, and adult peer pressure. Research suggests that it takes 8 to 12 years of training for a talented athlete to reach elite levels, or 10,000 hours of training, which results in 3 hours of practice daily for 10 years. Children shouldn't train more than 18 hours a week, but with pushy parents wanting their child to excel in the sport, the child may sometimes double this number, which could see the child have success and make representative teams and go on and represent Australia. But how much effect is this intense workload having on the child's young body? There are two types of injuries that can come about with too much training, which include macro trauma and micro trauma. Macro trauma is caused by impact, which includes fractures, tendinous strains, ligament strains, and soft tissue concussion. Overuse injuries, or micro trauma, include tendinitis, stress fractures, bursitis, and joint disorders. There are many risks involved with overuse injuries, with the main concern being growth of the child. Evidence suggests that growth cartilage in the child is less resistant to stress from repetitive training than a mature adult. The soft tissue of the child is also impacted and results in bones becoming tighter. Other risks placed on the child include muscle tendon imbalance, anatomical misalignment, nutrition, associated diseases, and psychological factors. Excessive repetition and short recovery periods for bones and tissues to withstand the workload impacts on a child, especially when they are undergoing growth spurt stage of their development. Excessive training for young children has detrimental effects on the child's health and well-being. The effects include overuse injuries due to the intense physical training on the still developing body, which may also lead to limit overall motor skills because most of the focus is on a training in a specific sport. There's also an effect on sociological and psychological development. The children miss out on social interaction because most of their time is spent training. The risk of staleness and burnout is also a concern for the child, and sport dropout numbers increasing due to children lacking enjoyment and fun because of the seriousness of parents and coaches wanting their child to be elite. A solution to this increasing problem of overuse injuries in young bodies could be that they are coached to practice more on correct technique and doing the right movements instead of intense training and regular competitions, which is impacting on their young body. Overtraining in children has detrimental effects on their young bodies. The child could go on to become the next superstar, but the parents and coaches need to take into account that the child's health and well-being is the main priority.